Hello, and welcome to the first session of the Kidney Foundation of Canada's 2024 Virtual Forum. My name is Carrie Thibodeau, and I'm the National Director of Programs and Public Policy. We're very excited to have you join us today for a frank discussion of the rewards and challenges of living kidney donation. Before we begin, I would like to review with you how to participate. We're offering all of our forum sessions bilingually using simultaneous interpretation. During this session, our speakers will present in French. To hear the presentation in English, click the interpretation icon, which looks like a globe, in the Zoom toolbar below this video and select English. We ask that you enter any questions you may have throughout the session into the Q&A pane below this video. We'll collect your questions, and at the end of the presentation, our speakers will address as many as they can. You'll also have an opportunity during the Q&A period to ask questions live as time permits. Please feel free to send any further questions to kidneyprograms@kidney.ca. For general comments during the session, there's a Feedloop chat box at the right side of your screen. Please avoid using the chat box for questions. They must be submitted through the Q&A pane to be seen and addressed by the speakers. The information shared in this session is not intended to be medical advice. We recommend that you speak to your doctor about your own individual situation.
I would like now to present our two presenters. Audrey Cragnou, she is a social worker and has been working since 2021 at the Centre Hospitalier de l'Université de Montréal, and she is also provincial coordinator for the Quebec program of living kidney donation. So she works with all the social workers in all the centers in Quebec in order to conceive and design tools to help people. And she also does some training programs and also has organized some meetings in order to share experience and information. And she also is in charge of coordinating discussions between donors and patients, and also focus and bring attention to people's she really wants to make sure that to enhance practices in favor of donors and receivers. And I would like also to introduce you Marie-Ève Cronet. She is a health professional and she worked in the hospital world for more than 15 years. She is now newly manager, and she's a general manager of 2 elderly homes. She is mother of 5 children, and she's also a caregiver. And she has in her this will and desire to help other people. She is very proud to participate in this Living Kidney program. So Audrey, the floor is yours. Yes, so it's in August 2018 that the program was put in place in Quebec, and its aim was to really increase the number of transplants given by living donors. So we were hoping to have 15 transplants by living donor per million of inhabitants by 2024, because in 2021, the average in Canada was 12.8 donors per million, but Quebec has never been up to this average. So in 2016-17, we were 6 for 1 million. And in 2021, we were around 7, 8 living donors. So we are really below the 15 transplants that we would like to achieve. So the transplant with living donor allows many things. The first thing is to plan to favor the plan of the transplant, because we know the date and we know the donor, and so we also can avoid delays that are on linked to the waiting list for people who are deceased, because when we are looking and waiting for a transplant from someone who is deceased, it can take very, very long time, and we need to have a compatible match as well. So the advantage with a living donor is to really favor preemptive transplant, so before dialysis, because dialysis, dialysis is really difficult. So we are working with 5 transplantation centers in Quebec. We have one in Hôpital Maisonneuve-Rosemont in Montréal, and the CHU in Quebec City, in Sherbrooke as well, and also the MUHC, the McGill Health Center in Montreal. So to implement this program, we have different strategies. And what we want is really to have a trajectory that's easier, clearer, and to really favor and promote this living donation, and also create some tools. So if we can go to the next slide, please. Wonderful. So here I will talk about our role as a social worker specialized in living donation. So I will talk a lot about the potential receiver and potential donor. The receiver is the person that can be eligible to a kidney transplant, and the potential donor is the person who would accept to give a kidney. So our role with the potential receiver is really to favor discussion, promote discussion, and to have them pay attention on the possibility of living donation. And they can now then talk about it with their medical team. So we want to question, we want to talk about it and discuss, because very often we don't know this exists and we don't know how we can benefit from it. So as far as the potential donor now, our role as a social worker is really to reach out and talk about the living donation with people who are curious, have an interest, and who maybe eventually would like to be a living donor. So our mandate is not to convince them, or we just want to accompany them and support them in this decision-making process, in this discussion. So it's really important they have a lot of information, the right information to make a good decision. So once they have manifested their interest, we support them during the process. And the first step is to look and evaluate, assess the social environment. And we want to make sure that their decision is very free, and they have received no pressure at all from anyone in order to give a kidney. And so we will support them during the whole process. And once the donation has been done, we want to make sure nothing will disturb the social functioning of the person. So, and when we look at our work with professionals, we want to develop knowledge and competencies as far as outreach and information about living donation. It's actually not an easy topic to tackle living donation. So there might be some false ideas and prejudices. So we really want to offer formations and training for professionals so they can really have the information to be to discuss this living donation So we offer trainings for in community organization and also in the health care system. And we are always there if ever they have questions or special needs as far as the activities we offer. And what I indicated in the next slide is that talking about living kidney donation is not always easy. Why is it not easy? Because very often people who need to talk about it more are people who are having health problems. So health problems bring a lot of emotions. We have a shock sometimes when we are told that we have a disease. It's tough sometimes to accept our new condition, and we can have feel all sorts of emotions. It can be anger, injustice, resignation, and others. And all these emotions uh, require resilience, and becoming resilient requires energy and time. And when people become eligible to a living donation, it can be a reassuring option, actually. But very often we think, how can we talk about it with uh, our dear ones and because sometimes we feel we're afraid to feel guilty or they will feel guilty. So it's a very difficult topic. So in the next slide, I've written all the questions that I've encountered most often in my practice. So I feel uncomfortable asking about it. We're not compatible. And what if nobody wants to do a donation? I'm worried about my health and my impact on a daily basis for the donor. I don't want this to change the relationship with the person. I would feel too accountable to this person that I will owe this person something, and I have no one to talk to about it, or it's against my values, or my donor is lives outside Quebec or Canada. So these are some of the main questions and uh, things that come up. Sometimes we find resistance. There are a lot of questions, and that's what our role is, to really support you in all this. And what we realize is that very often we lack knowledge. For instance, not being compatible with the donor. Have the tests been done? Do you know there are three types of donations? There are directed, non-directed, or cross donations. And when you say you have no one to ask to, have you explored all your network in the family, at work, friends, and have you looked at the different options? And do you know that you could actually choose the cross donation? Sometimes we can also be worried that the donor will lack money during the process, but you know that there is a program to financially aid, and sometimes we're afraid about the risks for the donor. We don't want to in any way impact the health of the donor. And do you know that there's a medical team that assesses the whole situation and the condition of the donor? So risks are being assessed. So there are a lot of questions. The last one, my donor lives outside Quebec or Canada, so this person is too far away. It's impossible. But it's possible. Yes, there might be um, some challenges linked to the process, for instance, visas and other things that take time, but it's possible. We, in those cases, ask donors to contact donation teams, because we know it's easier though to screen someone in Canada or Quebec. It's faster. And some people who are eligible to a transplant are afraid that it might be wrongly interpreted and like a request for a donation, and we put pressure on the donor. What we work on with patient is really change the idea that the receiver is asking. No, the receiver is informing. And when the people surrounding the patients are informed about delays and everything. Very often, actually, we have volunteers when they find out about the delays. And sometimes there's also a refusal or no response. But if you have uh, all these variables and you can talk about the health condition, and you can demystify everything around the living kidney donation, it can avoid sometimes some of the waiting uh, to receive a kidney from a deceased person, or extend also dialysis with discomfort that you know. So we're talking about a change of discourse. Instead of thinking we need to ask someone about a donation, we want to inform the surrounding the people around about the condition, the medical condition, and possible treatments. We are afraid to talk about these things. We're afraid to feel we owe something, and there's an impact with the relationship. The relationship with the donor will change, and these are very legitimate fears. So, but the idea is more to opt for. I want to inform my entourage, my acquaintances about my medical condition and the possible treatments. And sometimes it can be by a letter. Yes, sorry. It can be by phone. It can be an article in the paper. We've seen this before, or in the social network. So it's really using how the tool that the person is at ease with. So there is a very important dimension around the living donation. It's the idea of a free consent, free and informed consent, that the person takes the decision with all the information in hand. So it's really an idea. The idea is really to inform uh, acquaintances and people around. So can we go to the next slide, please? There are several tools we can use to help you and support you. And when I say we, is what I do is also being done in other transplantation centers in Quebec. So as I said, we really want to trigger discussion around living donation, and this is why we have these focus groups with the social worker and the patient's partners, donor and receiver, and people who've already, some people who have already received a kidney. So this is really in order to have good exchanges. And you are also free to participate and exchange in these groups, and everything that's being said there is confidential. It's not an intervention group, it's really an exchange group, a psychosocial exchange group, focus group. We really want to share information. So since the pandemic, these groups are virtual. They're in French and English. And what's absolutely wonderful is that in those focus groups where we exchange on discomfort about talking about living kidney donation, or someone can raise hand, so and say I'm interested in donating. So we often have people who come to really understand the reality of people who may receive a donation in exchange with it. That can be really.
Some people are less comfortable with the notion of a group discussion. We can offer an individual support with a partner patient. And so, again, someone who's already been through this process, someone who's already given or received. Sometimes there are some people who are more comfortable with when it's an individual support, and that is also possible. All of our partner patients have been trained we want them to understand our mission properly, that they understand that we don't want to convince anyone. We simply want to accompany people in the process. And so we offer a training for them to offer a support to those receiving and those who are not quite at the step yet. They can come and discuss it. And we have all sorts of references for them to read up on, for available information on living donation process. Usually we offer it once a month and you can register. A little later, I will share the coordinates and phone numbers of people who work in the programs for living donation process, and you'll be able to contact them. There, we can move on to the next step. This is my board. You see this poster up in all the dialysis centers and in the network here in the larger Montreal area. It's to invite people to come and discuss the living donation process and to question everything that might have them avoid or fear to discuss that. So we truly want to have a space to discuss all of that and all the steps that need to be followed to eventually have someone who raises their hand to say that they want to be a donor. You can, of course, take my number down and email and contact me for whatever reason. So you see my info here in the slide and from different social workers who work for the Quebecois program of living donation of kidneys. And if Marie-Ève would like, she can share humbly her story and her pathway as a living donor. And I am convinced that you'll be glad to hear her story. Thank you very much, Audrey. It was very interesting to see at what point there has been evolutions in the past 4, 5, 6 years. We see that society is working at supporting people who are waiting or who would like to receive a transplant. And so thank you to all of you for being here. And thank you to the foundation to allow me to discuss, to present you my story. I'm really excited because I hear that there's hope. We're in the era where we influence people at sharing and talking about what they experience and the challenges they face throughout the disease. And I'm happy to know that there are people who are there to listen and to support them. And that's really great. In the facts, I received the call. We might receive it instinctively to already know that people are suffering and who experience difficulties, whereas others don't necessarily have those difficulties and they can put themselves in their shoes. And so I'm a very empathetic person since I was very young. I turn a lot towards other people's needs and what they experience interests me a lot. And it starts from a shared experience that must be heard. I've taken that pathway. I experienced it hand in hand. I experienced it like a support, like an accompaniment, and it was very positive in the sense that I gave a kidney to an unknown person, to a stranger. To me, was a beautiful young girl who I offered health to by giving her my kidney. And that allowed her to take up her life again. Her life had slowed down when the disease was declared. And so it's important to consider to discuss with the trust, uh, having discussions, trustworthy discussions with people. That's where the relationship starts. And to talk about it openly, about our disease without judgment, without taboo, to trust that there are people who are there to hear us, near or far, strangers or not, people are there to make us, to help us move forward hand in hand and start that adventure together. And the person to whom I gave a kidney to was in the news at some point. She did a reporting talking about her troubled kidneys, and it inspired me. I wanted to meet her right away and to tell her I was there and I was interested in giving her this donation. As I said, it was a call that I got, and that we hear within ourselves. I can't explain what happened, but I was already very solicited or aware because I work in the field of health and people who live with kidney disease. It really affects me. I'm familiar with their daily lives, and I went through the process. And we've kept contact over time. We weren't very close prior. She's a girl or a young woman. We weren't very close, but I had to tell her that I was still there for her throughout the long process that lasted about 10 months in our case before D-Day, where I offered her a kidney. It's important to tell her that I was still there, still committed, and that I was going to go through the whole process with her. Everything Audrey's mentioned, the fears, the worry, most people experience them. I heard it from her own mouth. What's going to happen? What about your kids? Yes, I have 5 children by alliance. I had 3 of my own. My husband had 2 of his own, and I think it's a story of trust and to say, if one day I have sick children or I become sick myself, there will most likely be other people who will be there to accompany me at my turn. And so it's done on a trust basis and faith. And we have to break through the obstacles, like Audrey was mentioning. Fear crystallizes us, it is there for sure. And to go beyond that on a basis of trust by discussing what we experience, we're we are called upon us in society to discuss everything and anything. The foundations exist, whether it's for mental health or for the health system or to whistle blow different things. I believe that kidney disease is part of what needs to be discussed, and perhaps we have to leave our fear and worry aside. Eventually, there will be someone there to listen and with whom we can move forward together. It's not to influence, or I'm very empathetic. I accompany, I'm not a seller, a salesperson. I don't necessarily want to convince anyone, but in my experience, it went really well. And from my network, people who were worried about my decision, I had to reassure them. And that decision belonged to me. Even with the health system, again, as Audrey mentioned, we have a lot of medical evaluations, and I trust. Again, if they had told me you are not healthy enough for this or that condition, I would have trusted that it probably was not for me, the destiny in that sense. But I trusted the process, and it came out positive. And it's to feel that there are people around us with whom we can move forward to the unraveling. And probably I would have represented or advocated if my donation wasn't supported. I would have advocated for the cause, with children, what it is to give a kidney. And for me, it's a continuity of making right choices in health and supporting the right causes like the foundation of the Kidney Foundation. So I'm very happy to prove to you it's going to be 6 years in the spring. I'm still healthy. I'm very active and busy. And we said it, we've mentioned it in the framework of the process. Often people are not necessarily in better health, but they're a little more conscious of their choices. I make better choices that I might have done even if I had my 2 kidneys. And as I said, I have reserves. I have to use them in a conscious and efficient manner so that I am not penalized. I am probably in better health today because I've made better choices. And I'm proud to be here to talk about that with you. And I welcome any questions that you might have. I know that there are several participants here, and I hope that my French was well translated into English. Know that I am very proud to be here, and I trust, again, that you can discuss openly what you experience and that someone will respond to your call in the right way. Thank you very much, Marie-Ève. If ever you have any questions, she's very open to hearing them. Yes, Audrey and Marie-Ève, thank you for your beautiful presentation. There's a question at the moment that is how to know if we can give kidneys by in the pairs, and is there a decision that needs to be made to participate? I believe that what you're talking about, there are three types of donations: direct, non-direct, um, and cross donation. For compatibility, you have to wait for the right kidney. In Marie-Ève's story, it was 10 months. It's compatible with the person who must receive the kidney. If ever they're compatible, that's perfect, and that makes a pair. But if ever it was not compatible, we have the chance in Canada to have the program of cross donation. So we create a system of pairing in function of the compatibilities. So A might give to B and B gives to C, and that C receives from D. There is a cross system, and sometimes these are a little longer chains. And we have the chance to have donors who decide to give a kidney in an altruistic manner, who know nobody, but who have a kidney problem and who decide to give a kidney. It can create a chain in that context. And so it's an evaluation that will happen over several months, and will look at an exhaustive manner the entire situation of the patient, and to see how and if it's possible. It's a decision that's taken with the medical teams and, of course, with the Canadian Kidney Foundation. I hope that answers your questions. And that's why sometimes we have people who say it's not possible because we're not compatible. So I can't give a kidney to my close relative, but there are other ways, and there's some unknowns around the living donation of the kidney. That's why when someone is curious and they want to know a little more about that, we tell them, come talk with us, come see us, get information. You see, the Québécois program is pretty recent, dating to 2018, and Quebec is a little behind in comparison to the other provinces. So we have a lot of sensitization to do, and lots of people don't know what surrounds the living donor. And so we can tell you all about the process. Thank you for your clarifying question answer, Audrey. For the moment, let's see other questions. Can I also say what you see for this presentation today? Obviously, we were going to create it with a patient partner today. Today is Marie-Ève. It could have been other people who have been through this process, because often people who have given a kidney want to sensitize the next people about this process. And also, in fact, I don't see my work without the partner patients, because once a professional says that someone who's already gone through the process will come and sensitize other people and explain in a very honest manner, because patient partners are not there to say that everything went well, but they're there to give you the truth and tell you how the process unraveled. And so the truth, and that's why I'm convinced that in this virtual forum, you'll hear more patient partners, and often it doesn't have the same carry or the same influence. And that's why our patient partners are so precious to us. Great. I have another question. How many donors can present themselves to an eventual receiver? Is there a limit? There aren't any limits. Obviously, it's happened before that we've evaluated several potential donors for one receiver, but often who's the donor who's presented, who's compatible directly with the recipient. And we would evaluate the medical situation, psychosocial situation, who is the donor who can go farthest in the process. But it's happened to us that we've evaluated 2 or 3 people, potential donors, for one recipient almost at the same time. For the shoe, there are no worries. We want for potential donors to raise their hand and contact the transplant agencies to tell them that they're ready to get involved. And that's why we invite close relatives in the discussion group so that they can come and discuss their concerns with us. But to contact the Center for Transplant directly is a very good alternative because that's where they'll have all the medical, social information and the process to come. Perhaps, Marie-Ève, it was this way that you started the process by contacting the center? Yes, I communicated. I'm in the Eastern Townships in Sherbrooke, in Quebec. I contacted the nephrologic center at the hospital in Sherbrooke, and we started the exams. And over 9, 10 months, I went through all sorts of exams, and they do an entire scan of the body all the way until we consult a psychiatrist for a free and informed consent. So it's not just the physical body, it's although the spirit, and they really go through all the details. And when they called me back, they announced that I was a very good donor and that everything was in order to proceed. I trusted that everything that had been done allowed me to keep my health. And so issues, even if they were still present, I was reassured that everything was in order and it was well done because I'm still very healthy, as I was mentioning earlier. And there are lots of things. And often, when we want to give, the choice is taken, but we have to reassure our friends and family around us. And it can be pretty long. When we make a decision, we want it to happen right now. Like when we want a child, we want them in our arms right away. But I appreciate the term everyone learned to live with me in that sense so that on D-Day, my close ones would be with me and the recipient as well. And it's a process that's worthy because it's very important. It's done with lots of seriousness, and we're so well accompanied by all the different professionals, the medical corps, and the support in social work as well. Thank you very much. Okay, and another question. What are the questions that come up most often from your close relatives or friends? Audrey, maybe? Well, it often comes back to the discomfort that I noted earlier. The the relatives and friends of the recipients will say, "Oh, I can't give, I'm not compatible." There's often a lot of questions around the process, the medical process, around the functioning process of the Quebecois program or Canadian program of the living kidney donation. So there are often questions of all orders, organization, process, or about the pathway. So I don't know if that answers your question on the side of the recipients as well. I don't know if that answered your question. I believe she'll let us know. Another important question, can a teenager give a kidney to their parent? What I'd like to say, I don't want to speak too quick. I'm a social worker, but obviously with collaboration of, for example, the Saint-Justine Hospital in Quebec, but often it's the opposite case, an adult who has to give a kidney to a child or a teenager. But to the opposite, it's never happened. So I would advise to call the transplant center to know the answer. I cannot speak on their behalf. A question for Marie-Ève. Do you have a follow-up, an annual follow-up every year after your donation? Yes, sometimes it's every 14 months or once a year. That is what is established, often because we don't have a family doctor. And so the system, the service of nephrology offers a consultation with blood tests and analysis and urine tests, a whole medical review. And if ever there's a problem, the nephrologic doctor can refer us to the service. I don't have a family doctor for the past 5 years. And so I'm referred to the nephrology service in Sherbrooke, and it's the same doctor who's been following me for 3 years. It's something that's really good in itself because when we don't have a family doctor, we have to go through the emergency, and they've often taken care of small problematics. I've called the nephrologic center, and more quickly they deploy prescriptions for evaluations or analyses, and it's something I greatly appreciate. I have a last question. The evaluations in psychiatry, do they happen everywhere in Quebec and Canada? That's a very interesting question. Someone who must know the functioning a little. In fact, it's not everywhere in Quebec that you're evaluated by a psychiatrist. What we want is for all donors to be evaluated on the psychosocial level. The majority of transplant centers, there's a social worker who evaluates you, and depending on the needs, if there are particular needs, the doctor can decide to refer to a psychiatrist or to a psychologist. However, there was a time when there weren't always social workers present in the transplant center. So sometimes the evaluation was the psychosocial evaluation would be done by a psychiatrist. Now things have changed a little, but more importantly, whether it's psychiatrist, psychology, or a social worker, the fact is to be seen. Because, when a person decides to offer a kidney, uh, it's a motion that's very valued, and people are going, oh wow, you're giving a kidney, what a beautiful gesture. Even if those around you can be worried for you, what happens that at the moment that you're giving the kidney, the attention is focused on the recipient. We want the person to feel well, and so all this person who could have had all the attention during the process. That's why we want to make sure that there is a follow up that happens to make sure that the physical and mental health of the donor be good from the beginning of the process until several years after the donation. The majority of people who have given a kidney in the past would do it again in the future. If they had to take this decision a second time, they would do it again. But aside from that, it's not a gesture that is insignificant. It's a donation of ourselves. Once we've given that kidney, we don't have it for ourselves anymore. So it's important to be properly accompanied and well supported and surrounded. And as Marie-Ève was saying, in the months surrounding the process, often that's what it is. The donors will say, "It's we want it to go fast enough. We want it to go faster, but we want to make sure that the reflection that you have be well digested all the way until the moment that you give the kidney there." So I'm talking a lot. I've gone a little further than the question on psychiatrists, but in fact, there was a psychiatrist who was evaluating and now a little less there.
So does that wrap it for the questions? Believe that's all. What I could add, I'm sorry, I do speak a lot. I can leave my contact information in the chat, and if ever people have more information, more questions, they can write to me directly and ask the question. And once again, I'm sorry for the technical difficulties at the beginning. We had tested it before, but sometimes there are glitches happening. So thank you everyone for your understanding. I see there is a question in the chat. What do my relatives, what were their questions? Well, some people did think that it was not necessary for me to do this, that I was in good health. I had all these cesareans that were not easy, but then it was my decision, and I had this conviction that it was fine for me to do this, and I trusted also the health system, and also to see the scope of this gesture. Sometimes I'm proud to have done this gesture, but to have done this and to talk about it openly and to be proud, not survivor, but you can say that you're proud to be in good health. And some people have decided to donate to people from their family or relatives or unknown people. We're not here to convince or to have people, convince people to do this, but we really want to sensitize and raise awareness. And I'm really proud of this today. Maybe some surgeries did happen thanks to what I did. And of course, there are fears. Of course, there are difficulties and questions were asked, like, do you really need to go through another surgery? You're putting your own health at risk and your children's health as well, in a way. But there are a lot of ifs. I think we can put ifs aside, and I don't think I'm an extraordinary person. I'm a normal, ordinary person. If I did this, some other people would have done this for me. And this is what I was basing myself on to decrease people's fears and worries, because I was convinced and I could reassure them well, because we have one life. And if we can help people around, and if we can just like sign a card, that's the first step we can do, the first thing we can do. So it's something I wanted to say to reassure people. So I needed to reassure my young children. They understood that I was going through a surgery and there were risks associated to this, but using real words and a very sincere and non-judgmental discussion and words, because people did have these questions about why would you put your health at risk to save someone else, and it was my duty to reassure people, and I did this to the best of my knowledge. Thank you everyone for your questions. If ever we haven't answered your question, please send it to us.
Yay.
Thank you very much to our two presenters to having discussed this with us. Thank you also on behalf of our participants, who really appreciated your very positive energy.
Thank you to everyone for joining the Living Donation session. We'll see you soon.